Good afternoon. Welcome to another day Issues in Focus with Shibiki Rivals. It's always a delight to be here, a delight to explore issues affecting individuals right now in our society and even in your family. And today we are focusing on one such issue that affects women in general. So before we go any further, as usual, I'm gonna pray for the members of the audience, those of you who will be viewing this program. So let us pray. Great God and eternal Father, which art in heaven, hallowed be thy name. We are thankful for today. I pray in a special way that you will be with the audience and may you touch their hearts. And as they listen to this program, may you encourage them to be very sympathetic of anyone who may be going through this issue. Have your way, we pray, through Jesus Christ. Amen. All right, great. So some individuals are, for those of you who are viewing on YouTube, I want to say good afternoon to you. Those of you viewing on Facebook, hi, Kimberly, good afternoon to you. Ms. Deborah, I know Ms. Deborah was there since 1:47 waiting for this afternoon segment to start. And I thank you so much for the blessings, Sister Deborah. So it's good to see you. So for all of you who are viewing at this point in time, I just want to encourage you to share the link because there are so many of our women, many of our women who are affected by this problem and our men who don't know how to deal with the problem or how to deal with it, with whether it be their wives or their girlfriends or even their sisters who are going through these issues. So this afternoon, we're going to shed some more light on this problem. So we have with me, I'm going to allow the panelists to introduce themselves with the exception of Anonymous. She is here to share her personal story on this particular issue. So in any random order, panelists, all over to you. You're going to introduce yourselves.
Okay, I'll start. I am Omadel Vanessa Samuels, 2-1 attached to New Amsterdam School of Nursing.
Thank you very much, Ms. Samuels, for being here this afternoon.
Yes, welcome.
Gentlemen?
All right. Good afternoon, everyone. So my name is Lester Christian, registered nurse, midwife, currently attached to New Amsterdam School of Nursing, working as a nursing tutor. I must say that I'm very much pleased to be a part of this discussion this afternoon. Just so that I feel as men, when it comes to women issues, we tend to take the back burner. So I wanted to make a difference when it comes to that. So hopefully I'm able to inspire other persons to, do the same.
Thank you very much, Nurse Christian.
Good afternoon, everyone.
Good afternoon.
I am Samuel Ben. I am a registered nurse, and I'm also attached to the New Amsterdam School of Nursing as a 2-1, where I lecture mainly in pediatrics. It's a pleasure to be on this program this afternoon, and I hope that I can be able to share some of my knowledge with the general public. And thank you for having me, Ms. Fivehouse.
Most welcome, Samuel Ben. Doc?
Hello, everyone. It's nice to be with you. I'm no stranger to the program. I am Dr. Haidar, born and bred in the county with good food, Shibiki, and great personalities. And they all will agree with me. Kanji to be exact. Samuel Ben, I'm sure you'll agree with me. It's so nice to be with you all this afternoon to discuss PCOS, and we hope that something fruitful comes from it and that somebody here is empowered and emboldened.
Beautiful. Thank you very much, Doc. So I just want to say once again, welcome to all our special guests for today. And the other young lady, of course, I can't say her name, but when you see Anonymous there, know that she will be sharing her story sometime during the program. So we're gonna get straight into it. And so the first question that we would want, like everybody would of course want to know, what exactly is PCOS? Because the term wasn't knowledgeable to me before, right? So let us explore it.
You know, Shabiki, there is a lot of persons like you, they don't know what PCOS is. There isn't much talk or health education or public health education about PCOS. But it's definitely something that we need to bring to the front burner and we need to discuss more because it's becoming more and more prevalent. So for those who may not know what the abbreviation stands for, it is actually polycystic ovary syndrome, or some people say polycystic ovarian syndrome. Potato, same thing. In terms of what it is, though, it, as the name suggests, affects the ovaries and is mainly affects the hormones and the balance of those hormones. There are three features that doctors and nurses and healthcare professionals in general will refer to when they speak of PCOS. And these three things include your periods, your menstruation. So usually there's irregular periods. The other thing is an excess of male hormones, which we refer to as androgens. And because we're talking about the ovaries, of course, we need to bring in the ovaries at some point. And so you may have polycystic ovaries, or you'll have ovaries with quote unquote cysts, small cysts, or follicles rather. And these are the three things that we look at when we want to diagnose polycystic ovarian syndrome.
Thank you very much for that, Doc. So I'm going to ask any added information from our tutors.
Yeah, so I think something that is also important to note is that for persons with PCOS, doctor would have mentioned the three hallmarks of this condition, but there are times when persons might not have all three of those. So maybe they might be displaying two out of the three, and that can still be a reason or cause why they might be diagnosed with the problem. Because it's not at all times that they're going to manifest, let's say, for example, the cyst, particular cyst on the ovaries or so.
Okay. Thank you. And just before I take the other comments, I just want to say welcome to Sayuni Clark and Ashiba Prasad. Remember, for those of you who are viewing, the only how I can know that you're viewing directly, you can place a comment in the comment section, whether on YouTube or on Facebook. And remember, please share this broadcast here because we need our young women to be edified about this issue in particular. Any other added information?
Yes, one thing that it needs to be noted also is that this is a hormonal disorder that is actually affecting those women that are in that reproductive age, right? And so that's the main focal point. Those of reproductive age, that's where it's going to hit you the most in that that age range.
Wow. All right, thank you. Nurse Samuel, and I must say something, Nurse Samuel, you know, before I know Nurse was trying to connect and, you know, she was experiencing some technical problems. And I said to the gentleman before, I said, it is so ironic that I'll be dealing with a female issue and we have our males on the platform taking the front burn. I know Nurse Lester would have alluded to it earlier that, you know, he's happy that they're taking many men shy away, but he's taking the front burner on this issue. So nurse, when you came in, I was so happy. I said, yes, there's another woman on board here. So just by any chance, the men cannot really understand because, we are women, so we know our bodies and everything. Just in case the theoretical knowledge cannot fill the gap of today's program, at least there is somebody here who has practical experience to share. So I'm so elated that you got to join us. So nurse, do you have anything else to add to this?
Okay, thank you very much. To add, I would say that women experiencing infertility, they might not know the cause. And most women would say they have hormonal imbalance. But it's after investigation, then they get to know that there's a specific reason. And most times it is due to polycystic ovarian syndrome.
Wow.
So women, they postpone visiting the doctor. But for us, we know infertility, you start like diagnosing infertility from, I think, after 2 years of trying, brother, doctor, 2 years of trying to conceive. But women or couples wait longer. And the longer they wait, it becomes, the chances become a little slimmer.
Wow. All right. So thank you for that added response there. So for those individuals who are married for several years, we're not saying that would be the problem, but perhaps it is the problem. So you need to check it out. So what I want to know in terms of the symptoms, because I know when we have these issues, there must be some sort of symptoms that people may know that, hey, I need to check. Maybe it's this. What are some common symptoms of this this issue? By the way, on one note, what do you call it? Do you call it a disease? Do you call it an issue? Do you call it, what if you had the generic scientific term? What would you categorize it as?
It's a syndrome, Shibiki.
Syndrome. All right, great. So I need
It's
to
a
start
collection,
using it.
right? It's not one thing.
Oh, interesting. So you see, I am not that much brilliant in the sciences for nothing. So when it comes to sciences, I'll sit and I ask 1,000 questions, right? And I'm happy that individuals can bring it to the forefront here. So back to the question, what are the symptoms
Just before we go there, Shibiki, I think it's important to reiterate what the Aaron was saying earlier, that with those three hallmark points that I mentioned, in order to diagnose this, the patient must have at least 2 of those, right? If you're only exhibiting 1 of those, then it's not PCOS. You must have at least 2.
All right, so Doc, what I'm going to ask you to do, could you please type the 3 in the private chat column so that I can put it up on the screen so that persons can be able to, those of you who are viewing, you can take note, have your notebook there, because this information, you remember you have the opportunity to have asking questions. You may not find it anywhere. So you have these individuals right here who are willing to address the issue at hand. On that note, I just want to say welcome to Carol, Ashiba, Abiola, and Sister Joyce and Sayers. It's good to have all of you viewing today. Don't forget to share this broadcast. There are other women who are affected and they may not know, and this might be their breakthrough for them that they're looking for. All right, thank you very much. Let me see. So Doc is putting them on. So we have the first one here. I'm gonna put up on the screen. Just a moment. The first one, if by chance you are experiencing irregular periods, that's one of them, women. And I know several because I have a lot of female friends and, a lot of them have irregular period issue. The other one is excess male hormones or androgens. How do you know people have excess male hormones? They have to check it out first, right?
You'll hear that in your next question, Shibiki.
All right, great. All right. You see, I'm getting anxious, for this particular topic. And The final one we have polycystic ovaries. So those are the three. Great. So just for in the event, those of you just join in. So these are the three hallmarks. Number one, irregular periods. Number two, excess male hormones or androgens. And number three, polycystic ovaries. So we're gonna go straight back to the table. What are the symptoms of PCOS?
All right. So while we're on the topic, since we're on the topic of the symptoms of PCOS, I think it's important to know that we all know that everybody is different, right? And this syndrome, there can be many variations in clinical manifestations according to individuals. But there are some things that can occur, and Doctor would have mentioned those um, uh, the key factors that come into play as it relates to POCS. But those things, when you look at, he mentioned excessive androgens or male hormones. We see that the male hormones has to do a lot with secondary sexual characteristics. So, for example, hair growth, right? So you might find women having what we call hirsutism, right? A lot of hair on the chest, facial hairs. You can also find that they might suffer from male pattern balding. So like the hairs on the head start thinning, especially in the middle portion. We know the typical thing that men, some men go through, right? So we see that with these women, with these women, irregular periods, definitely. All right. So in some cases, there might be the absence of it as well. Right. Persons might also experience some sort of pain, pelvic pain. We do have persons reporting that as well. Infertility, right? So sister was talking about after 2 years of trying, then that is usually diagnosed. And this is one of the things that you definitely see in these individuals, because you expect, if you're trying to get pregnant, then you expect within that first 1 year of trying, and studies have shown that most persons, about 90% of individuals, do get pregnant within that first year if everything is on the up and up, right? So if that is not, you're not seeing that, and you're experiencing some of these other signs and symptoms, then it's important that you do a checkup, right? It doesn't mean that you do have it, because there are other things that can also cause some of these issues to arise, but it's definitely something you need to look into. So acne as well, I think, is a big issue that you find in these persons as well. Weight gain, I know. High blood sugar levels.
Wow.
All right. So there are a lot of things that can occur because of this.
Thank you so much.
Yes, when you're looking at these irregular periods, right? It must also be noted that within this is that the menstrual cycle, right? The intervals, instead of that 28 days, you can end up seeing persons having it 35 days and more interval between menstrual cycle. Uh, less than 8 cycles per year In fact, in some cases, they might have a menstrual cycle 4 months, every 4 months, and even more. You can have a prolonged periods that are scanty and heavy. So when it eventually comes, it's real heavy, right? And then it could be when it comes, it's just a little scanty something, right?
Mm-hmm.
With the excessive androgen, as brother Christian would have said, the high levels of hormone, right, will result in you having those extra facial hair and body and facial hair, right? The adolescence acne, the adult acne, the
Mm-hmm.
male pattern baldness, as he was referring to. We know when males are bald, how it usually be. And so for the female, that is what will end up happening to you. You will have that happening. And with the polycystic ovaries now, they become enlarged and they will contain numerous small fluid-filled sacs, which are going to surround the eggs, right? And this will result in the ovaries failing to function regularly. And so it cannot function as it is supposed to. So you're going to have problems there.
All right, thank you very much, Aaron Ben. Sister?
Let's sister go. Yeah, let's sister go.
Doctor, we want to hear from doctor.
So I agree with all that was said. Those are majority of the clinical manifestations. One of the most popular ones, though, that we see patients coming in the clinic complaining of course, is the irregular periods. Sometimes we have patients, though, coming in complaining of no periods at all for years, right?
Mm-hmm.
So we can
Years?
have what we call an
I'm
ovulation,
married.
right?
And
That's no periods for years. In terms of another one that I didn't hear being mentioned is blackening of and thickening, like a velvety look on the skin. You know, we have excessive blackening around the neck region, under the arms, and we call this Acanthosis nigricans, right? This is also something that we should look out for, and most often present in those diabetic females. Um,
mm-hmm.
and in terms of insulin, like Brother Christian referred to, what these patients have is insulin resistance. So even though they have insulin, their body isn't responding, the cells aren't responding to the insulin that they have. And so the body, in an effort to compensate, is going to produce more and more
More.
insulin. Right?
Mm-hmm.
Right. So we have an excess of insulin. And we know, of course, these patients are oftentimes obese, and obesity is a major cause of insulin resistance as well.
Yep.
Thank you very much, Doc. All right, sister.
I think the guys have exhausted the signs and symptoms. All right. Yes. Everything. Did anybody mention acne?
Yes.
Yes. But that's the only one. The female will have regular breakouts,
Mm-hmm.
right? Areas of the face, chest, and upper back.
Okay.
Mm-hmm.
All right. So
Right. And
women, just
just
like
to
how I
add,
am learning.
just to add,
Yeah, go ahead, Doc.
another symptom that, of course, because we're talking about PCOS, and this is a symptom because is the cysts on the ovaries, right? And this is noticed via ultrasound. So we'll send the patients to do an ultrasound, and they'll bring back an ultrasound saying that they have cysts, small cysts on the
Mm-hmm.
ovaries. Usually they're smaller than 8 mm or so. and they have multiple cysts on the ovaries. So what the ultrasound is going to say in essence is that the person has a big ovary, an overgrown ovary with multiple cysts.
All right. So, sister, I'm going to start you off with this question. In terms of the statistics on polycystic ovarian syndrome, I want to know how often, first of all, if there are stats on this issue, perhaps the percentage of women affected by it, and how often, I mean, do women report this issue? I mean, you're professional, you were in the field for quite a number of years, I should assume. Yeah.
Yeah, my average, I don't have the direct figure. I think Dr. might more help me in that line. I would say about 75% of patients when diagnosed by the medical professionals. But most women would have infertility, but they would not know the direct cause. Right? And from investigation, I would say 75% might be diagnosed. Doctor,
And how,
please shed some light on the statistics for us.
and just before I take Dr. Kedar, I want to know also how often do women report this issue?
Most women would not know because it's a fairly, or with internet access and so on, most women might have an idea, but I'm sure a lot of women do not know
Okay.
about polycystic ovarian disease. They might more come to say they have hormonal imbalances or they're trying to conceive. They might express some infertility after trying, as I said, but they might not know the direct cause.
Okay, understand.
Mm-hmm.
All right, thank you. Doc?
Sure, Shabiki. PCOS is not a new thing. It's been around for a while. Research has shown that it has been there since 1721. Um, and that's when the Italian physician Antonio Valsineri, or something of that sort, discovered a patient with the same symptoms. However, in 2003 is when this disease, this syndrome actually started to come to the forefront. And that is when somebody smart came up with a Rotterdam criteria, and that is the three things that we mentioned earlier: the irregular periods, the androgens, and the ultrasound finding of polycystic ovaries. So since 2003, the stats have been rising. It's becoming more prevalent, and they have seen an increase in the incidence, which is the number of reported new cases. However, there isn't much stats for Guyana per se, but what they say is that in the US, it affects 1 in 10 to 1 in 20 females, and that is a whole lot, just to say. Also, it's worldwide, it's approximately 2 to like 2 to 20 or the late 20s% of women. And all of these women, of course, like Elder Ben said, is in the reproductive age. What I can say though is that lately we have been having an influx. Well, there has been an influx of women coming to the OBGYN clinic who have been diagnosed with PCOS. It is definitely something, Shabiki, I believe somebody could pick up and study because there's great incidence and prevalence of this disease now.
Wow. Thank you for sharing those stats.
Expanding on Dr. Haidar there, as he was mentioning with the US, there are some places that you can find the statistics would say that in the US, in worldwide, it can be as much as 1 in 15, 1 in 15, and more so in 2012, they would have found that it's approximately 116 million, which is 3.4%. Recently, however, they would have said that it's now variable, and it can be between a range of 2.2% to as much as 26%. And so, as Dr. Haidar was saying, it's becoming more prevalent now. The statistics are continuing to show daily that this is something that what we thought was just an ordinary something before is becoming more and more prevalent in society. And because of the fact that people, as Sister Samuels was saying, they're just accustomed, okay, I have irregular period, it's just a hormonal something, and so they leave it as that, and they don't actually get it investigated. And by the time they would have done that, it would have been far gone.
So is it safe to say that, okay, for example, if as a woman, and let's say I am missing my period for like 3 months, I notice I haven't gotten my period. Is it safe for a woman just to say, hey, let me go and check up to see if that may be the issue right away?
Yes, Shabiki, definitely. It is cause for concern. Any normal woman should have their period, should have a normal 28-day cycle, which gives them a period approximately every month. And if you should miss that, you should be on the bandwagon to get yourself checked out. In terms, you asked a question, and right before Aaron Christian speaks, I wanted to shed some light on it. You asked a question right after this one, and it's something to the sort of if women report the issue.
Yeah.
So in terms of reporting, I think what happens, as Elder Ben was saying, you miss your period for a couple of months and you think, you know what, I might just have some hormonal imbalance, and who knows, I give it some time and maybe it go back to normal. For some women who are health conscious, they ensure that they reach to the clinic in no time. Tests, of course, because this is so prevalent now, tests will be conducted, and in a jiffy, they'll receive their diagnosis of PCOS. What we have been seeing, though, in terms of reports, is coming mainly from those women who have started to experience androgenic symptoms. So those symptoms like having a moustache or a beard, developing hair on their chest, their hair falling out, we'll have these women coming to the clinic. Also, those women who have been gaining weight and have been missing their periods. Those are the women that will report and show up to the clinic. So it depends on the situations and how severely affected the women deem themselves. That will depend how quickly or how long after they report to the clinic.
Okay, thank you for that. Whew. Go right ahead, Aaron.
Yeah, so I think one of the things that Sister Samuels would have mentioned earlier, I think is very important as it relates to the question of reporting of the issue. Most times when persons actually find out that they have a problem is when they're trying to get pregnant and then they're not, right? Then is when they'll probably seek some medical attention, and then they're because the symptoms, for lack of knowledge, right? Mr. Ben was talking about, you might be experiencing these clinical manifestations or symptoms, and because you don't know about the condition, because you don't know about the seriousness of it, then persons might just fail to report until, let's say, they get married, because these signs and symptoms can start as early as the teen years, right? Early 20s and so on. But persons, especially in those years, you're not necessarily thinking about those things, right? So it's not until now when you're ready to start a family that some persons actually find that out. So yes, there are persons who we do see from time to time, persons who are very health conscious. When they see certain changes and so on in their bodies, they would, even if they do not, let's say, go to the doctor, they have a nurse friend or a doctor friend, they're going to find out about these things, right? So the good thing about that is that they can be advised to at least go and see a gynecologist or so on.
All right. Thank you very much for sharing those information. So the final question before I take Anonymous, she is going to tell us her story, her personal story, and how she has been dealing with PCOS for the period of time. All right. So there's also a question on the table, sister, and the two RNs. So take note of that question by the time before we go in. As a matter of fact, as we dealt with symptoms, let's deal with this question here. So this question came from Natasi. She says she's been hearing that women who gain weight may have this syndrome. Can loss of weight be one of the signs too?
Yeah, Shabiki, I feel like you wait for me to answer the question, but I know this parents and this sister is more than able to answer this question as well. The loss of weight is a vague symptom that can be related to any disorder. Majority of the metabolic disorders, persons will lose weight or gain weight. What's specific for this syndrome though is a gain of weight. You know what can happen though? Persons might be having problems with their menstrual cycle. They might not be having it, missing it for a long period of time, and they might be losing weight. One of the things you want to consider is a thyroid problem. And this is definitely one of the differential diagnosis or something to be considered when we see patients like this. What happens is because our hormones are not functioning as they should, it affects so many other organs and parts of our bodies. And so this person can, not necessarily have, but can have a thyroid disorder. Most times, majority of the times, and these nurses can tell you, these patients with PCOS are going to gain weight. However, I don't want to go too much. However, if this patient is experiencing a complication of PCOS, like endometrial hyperplasia, which is a growth or a thickening of the endometrium, that puts the patient at risk for endometrial cancer. And we know with cancers you can lose weight, but that's as far-fetched as it is a possibility. But you'll need to ensure you check with your doctor. That is going to be the best advice I can give to Miss Edwards. Check with your doctor. It's a vague symptom, loss of weight.
Thank you very much. And then there's another question before I go into our next question. Sister Joyce says is asking if there's an age range in terms of person affected. I know we have been mentioning the reproductive age, but is there a specific age range that a lot of persons would have maybe come to the forefront with this issue?
Yeah, so the reproductive age is definitely between 14, 15 to 45 or 50, anywhere thereabout.
Okay. And I don't know, any one of you? Yes, go ahead, sir.
Yes, one of the things that, and I think I did allude to this earlier, is that persons generally, or when they first start to display some of these symptoms, it's usually late in the teen years and early in their early 20s. Then is when they start to show some of these clinical manifestations.
Okay. All right. So I trust that addressed the questions, Sister Joyce and Sears and Tassie. And so the other question before taking Anonymous, we want to deal with the issue of infertility, because I think this is one of the biggest things that women I think for the very first time last night, I know Nurse Samuels, maybe you can vouch for me here, or for the other for Dr. Haidar and the other men who are on the program here. You may have heard your female friends or even your mother or sisters would have said they're fed up with getting period. You know, I don't know why we have to get period. So last for the first time, I was lying on my bed just contemplating today's program. I'm like, Lord, you know what? There's some people, they're happy if their period could show up because they need to have children. And for the very first time, I said, Lord, thank you for a irregular period cycle. The very first time in my life, I ever said thank you for that. And sometimes we don't know how
So
good we
true.
are until we are listening to other persons going through
Until
their issues. And then we're like, hey, after all, we wonderfully created by God, but just so we complain about our regular cycle in life of life. So women who
cycle.
listening,
Mm-hmm.
come on, buy those
It's a
sanitary
blessing.
napkins and enjoy your period monthly. Because until, especially for those of you who want to have, for those of us who want to have children by God's grace, we may not know how beneficial it is until that period, that particular point in our life, right? All right, good. So back to the point of
Mm-hmm.
infertility. How does PCOS affect infertility? We can start in any random order again. I haven't heard Samuel. Samuel, I'm going to start with Samuel. Samuel, are you there?
Yes, I'm here. How does it affect infertility? That's the question.
That's right.
PCOS affect. Good. What you will find happening, right, is that because of the increase in the androgen.
That's
In
right.
addition to that, what you will find happening is that those follicles, as I said before, it affects the regular function of the ovaries, which would mean to produce the eggs, as we usually say, right? And so, in order for you to become pregnant, they have to be an egg, right? And so if it is not being produced regularly, if it's not being produced at all sometimes, right? Then it simply means that you can't get pregnant. And so those things that are going to affect it, as simple as this the polycystic ovaries, right? Those little sacs filled with fluid that surround the ovaries, right? As simple as that happening, it can affect you having children, because you will be infertile, because as I said before, they have to be eggs, right? And you have to have ovulation, because it's going to affect your ovulation. If that is not happening, then yes, it's going to cause you to be infertile. That's putting it in a nutshell.
All right. Maybe we just take one more comment on this question.
Okay. Mhm. Okay, as we know, women must experience the menstrual cycle, right? Certain things occur due to the influences of hormones at different points of the period, right? Because the most fertile days are, some people say 10 to 14, 12 to 14 days. That's the middle of the cycle. But if there are prolonged periods or short periods, the hormones are interrupted. Right? So, in order for a woman to become pregnant, she must experience a regular menstrual cycle, in other words, so that the hormones would be released at the same time, or the amount of hormones would be released according to the time of the cycle. That's in the most simplest form or terms.
All right, thank you so much. All right, so
Just,
we are going to
just
take,
to add
okay,
Shibiki,
go Doc.
um, as they both would have said, if you don't have ovulation, then you can't be pregnant. Um, the uh, PCOS is one of the most major causes of infertility. And approximately 70 to 80% of persons with PCOS are infertile, or they have some sort of fertility problem. Whilst it's hard to get pregnant, I just want to put it out there that it is possible. You can get pregnant with PCOS. However, with that pregnancy comes a lot of risks if not managed properly. So this person will be at risk for premature delivery. This person will be at risk also for high blood pressure and diabetes during pregnancy or gestational diabetes. And there are going to be some risk, but if you are in a dying need of having a child and you have PCOS, know that it is possible. There is
Possible.
hope that you
With
can
treatment.
get pregnant. Um,
Mm-hmm.
and know that you have to put in the work as well. So lose that weight, exercise, and so on. Hope that
True.
everything will go well.
Weight loss.
Yes.
Certain.
Yes, thank you. So, Anonymous, if you're hearing me, you can go ahead and share your story. In the meantime, I'm going to ask everybody else to mute their microphones so that um, we can hear from her. All right, she has just been disconnected. Okay. All right. So while we wait on her to be to connect, one of the things let's just move to the next question. So in the event she connects before we started, as a matter of fact, let me just go on a short break. I just want to say I forgot to mention this, but happy Teachers Day to all the wonderful teachers. I know this particular flyer came from Sister Joyce and Sayers this morning when I woke up and I saw the message. I'm like, hey, I saw a few other messages from my students, ex-students, and I say thank you, even though I'm not in the teaching profession right now, but to all our hardworking teachers, especially during this Zoom era that I mean, it's so difficult for you guys, but happy Teachers Day. And I must say to all our teachers who are viewing, or for those of you who are on my Facebook page or who are on YouTube, I must let you know that parents there have never been a period in Earth's history that parents really and truly appreciate the work that you guys have been doing. It is now. And I can tell you for a fact, I've been talking with a few parents, and for the first thing, they're like, I can't wait for school to open for these children to go back to school. So teachers, you have been doing a fantastic job. And I mean, it's surprising that parents, some parents, sometimes they only know when they need you, when they really and truly cannot do things for themselves. But nevertheless, teachers, just enjoy your day. And secondly, I just want to invite each and every one of you to the Bible Speaks Empowerment series. If you are on Facebook, whether you're a Seventh-day Adventist or not, you cannot be on Facebook and miss at least one of these recordings. And I want to invite you to join in this evening, whether it's on YouTube or on Facebook. And tonight they are Pastor is looking at the topic border control. So you need to tune in. You can share the link to your friends. Just tune in at 7. You can just type in Guyana Conference of Seventh-day Adventists on YouTube or on Facebook, and you will get to see this recording live. You would not regret it. All right, great. So that's all the 2 ads for now. I'll give another intermission a little later on to show you another advertisement for you to support our young people. So Anonymous is back, and if you're hearing me, welcome back, and you can go ahead and start sharing your story now.
Oh, hi everybody. Good afternoon. Shabiki,
Afternoon.
thank you so much for having me on your program.
You're welcome.
Um, PCOS. Oh, wow. PCOS. How? I don't know where to start. um, so ever since I first started my period, which was like I was at the age of like 13, between 13 and 14, I can't remember. So I've been having difficulties where I would be having really heavy periods and I would have a lot of pain. And so when I visited the doctors, because it was so unusual, all they would say is that you know, my blood count is low, and at first they told me that I only had um, ovarian cyst. So as the years goes by, it started to get worse and worse and worse. And so I took it upon myself that I needed to take a step forward to find out exactly what is going on with me. Um, Throughout my secondary life, that is when, like about 2 years after, I should say, that is when I found out that PCOS. Um, it's not easy to deal with. Um, I've been struggling with irregular periods. Sometimes I would get my period for the entire month, where it would just come like on the 30th or the 31st or the 29th or the 28th, and it would continue to go over to the other month. And so pain as well as back pain, and it was so intense that when I get this pain, I would end up in the ER. And when I go there, all they do is just give me an injection to help with the pain, and that was it. It's something I've been struggling with from ever since up to date. But what I find though is recently, about a year ago, I should say, I also found out that I've had some thyroid issues. Mind you, I've been going to so many doctors because of this PCOS, and I did so many blood tests and a lot of ultrasounds and stuff like that. Um, no one up to late, I think it was late last year. All these doctors that I visited, they never told me that I had this thyroid problem. And so last year I got really, really sick. And so because of that, I had to visit back home, which is Guyana. Sorry to say that I'm not living in Guyana. So I had to go back to Guyana, and that is where I found out that I also have some thyroid issues, which I know it contributes to um, some of the problems that I'm having as well. Um, PCOS, it's like I cannot find a word to describe how it's affecting me. Um, you know, I have irregular periods. I have so many like so many symptoms. Like I don't know where to start from. Um, One of the issues I've been dealing with, though, trying to get some answer to, is why is it that
Okay, so she will reconnect again. I know the internet access from time to time. So doctors, you have heard, I mean, for those of you who were with us from since the beginning, you have heard her mentioning some of the same symptoms that were mentioned by the persons, members of our medical personnel on the panel. All right, great. So she's back. All right, you can continue.
Uh, Sorry about that, guys. I don't know what happened to the internet. Yes, like I was saying, some of the issues that I'm dealing with, and it's my major concern is why is it that when I am on my periods, I'm passing so many or so much of clot, and in the course of passing it, what would happen is I would feel like from my waist go downwards, I would feel like a really, really hot pain coming on. And what I would normally do is I go and sit over the toilet. And when I pass that clot, it's like when it's coming down, the pain is so intense. But the minute it's out, the pain just it goes away. That is my major concern. The thing about it is, I've been to so many doctors and I've did so many tests, and it's like a roller coaster for me. They keep telling me one thing over and over, and it's just repeating and repeating, doing this blood test, doing that blood test. So I'm at a point now where I I don't know what to do anymore, um, because of the fact that every time I visit the doctor, it's the same thing over and over, and like there is no sort of help, I should say. And another problem is the medication that they give me. I can't use them because of the fact that it's been so many years since I'm dealing with this PCOS. So it's like my body is accustomed to these medications. And so when I do use them now, I get some sort of side effect or I get so sick with them or something of the sort. So I don't know what to do. I used to get like really, really bad pain, and someone advised me to go see a chiropractor. And so when I did that, because of some issue with my back, so when I did that, what I find is from ever since um, I visited the chiropractor, when she did whatever it is that she did, I find now it's been about a year now that the pain is no longer there. It's not as intense as how it used to be before. And so that really helped me with the pain, dealing with the pain, but nevertheless, I still do have some pain, which I could deal with. Um, I still do have my period, it's not as regular, I should say. From since last September to now, I've been getting it every month, but the issue is that instead of getting it for 5 days or 7 days, I would normally get it 12 to 14 days, maybe 16 days. And so they're just, some of the things that I have to deal with on a regular basis. Every month, I have to go through. And so with the thyroid as well, I really don't know what to do. It affects me so much. There is time where like I feel like giving up. I would be so stressed out over the situation. Like I would just bear my pain and I would just keep to myself because like going to the doctor does not help me anymore. And it affects me so much because like with my husband, he is so supportive, but there's only so much a human could handle in situations like these. And so sometimes, it's very frustrating for him to know that I have this issue and I've been going to several doctors and I cannot get any sort of help. And so it is frustrating for me as well, because like, I know my chances are so limited in getting pregnant. and that also affects me mentally, physically, emotionally. So, these are just like some of the things that I'm going through dealing with PCOS. Like you guys explained that, um, there is a possibility that you could get pregnant with PCOS. I know of a few persons who has PCOS, and yes, they did get pregnant. But with my situation where I cannot really use medications like that anymore, it's very frustrating for me. I don't know what to do, how to deal with it, or how to go about getting um, any sort of help. So I'm so thankful that Shibiki invited me to this program, and I do hope that maybe I could get some sort of advice here, or you know something that could help me to move forward.
Thank you so much, Anonymous, for sharing your story. Um, all right, over to you, the panel. You can make reference. I know she asked questions in between, and we can just talk a bit about that because only last night, another friend of mine, after seeing the promo, she would have messaged me, and she said hopefully that at least those persons who will be in the panel can be able to say something or at least refer the individuals who have been facing. But just before I take comments, I just want to put Tonette Johnson, she would have placed a comment here. So all of those individuals who are looking and you may have this problem, or you may know of individuals who have this problem. So Tonette says here, in Guyana, there's a support group that has been formed for persons with PCOS. It's called Sisterhood Support. Guyana is a support group that caters to women living with or have loved ones with PCOS, raising the awareness of this disorder within Guyana, providing educational and support services. Um, so there is a Facebook link there, Sisterhood Support Guyana. For those of you who know me personally, you can send me a private message, inbox me. You can maybe send me a message directly on Issues in Focus too, or on my WhatsApp, and I will send you the direct link, and you can join and dialogue with those individuals. Thank you so much, Sonette, for sharing this. Yes, over to you, panelists.
All right, so I must thank the sister for sharing her experience. And one of the questions that she asked earlier was, why she's experiencing these heavy menstrual flow when she would have or when she has her period. So and I think doctor would have talked about this a bit earlier. Now, when you look at PCOS, it's basically causing some imbalances in hormones that are responsible for these cycles, ovulation cycle, menstrual cycles. And one of those hormones that persons generally have a problem with is progesterone. All right. So what you might find is that there are these follicles that are producing that are there in the ovaries that are responsible for producing the eggs and so on. They might be producing estrogen, which in some ways helps to build and thicken the lining of the uterus. So what you might find is that in these persons, they might still be producing this estrogen. So you're having the thickening, but then they're not having that sort of balancing hormone, which is the progesterone, right? So when they do now, let's say they do now have that period because of that buildup, that is why you're going to see that sort of heavier flow because of all of those sort of changes that would have been occurring within the period of time that you are not having a menstrual flow.
Okay.
Mm-hmm. Just to add a little on what brother already explained. Maybe one reason for the pain that she's having while the clots are being passed. It's like the effects of estrogen on the uterus that will cause it to contract, thus
Oh.
expelling those clots. So that may be the reason why she's experiencing pain while those clots are being passed.
Okay.
And I think another area that I heard her talking about was the fact that it was difficult. She had some challenges with getting a particular diagnosis, right? So she had a problem. She kept going to doctors, and she was not receiving that any sort of answers or tangible answers. And I think this is doctor would have talked about it as well. Even though it's this is something that has been around for some time. When you look at I mean, there's still ongoing research. There's still a lot that we don't know about why this occurs and all of that. And studies would have shown that it can be difficult to diagnose at times because there are many other problems basically that can cause some of the same symptoms, right? So sometimes it's hard to diagnose that.
All right. Thank you very
And
much.
I
Just
think
before,
yes.
go ahead, Lester. No, I just wanted
Oh
to know
yeah.
if Anonymous had anything to say because I noticed she had put on her microphone sometime earlier while one of you was speaking. So if you have something else to add or to comment on, you can send me a private chat color. Yeah, Anonymous. All right. So all right. So Anonymous, you can send me a message in the private chat column. So just in case you have anything to
Sorry,
say.
dear. Yes. So one of the problem I have is that um, when I have my period, can you hear me?
Yes, I'm hearing. No, your microphone is muted. All right. Let's go ahead.
No, I was just going to say, and this is based on what Doctor would have said earlier as well, is that because
Yes. Sorry, dear. I don't know what's happening.
okay, yeah, because of some of the there are other conditions that can lead to some of these clinical manifestations. I think one of the things that you would find, and this is very frustrating for some women, and the sister did refer to this, is that you might find a doctor is going to order a lot of tests for you. All right, so I know that is a problem that a lot of persons complain about, and they're going here, there, and everywhere, right? And it's because of what I would have mentioned. Sometimes it's even difficult for us to determine, what exactly is going on, because uh, this, as we would have alluded to earlier, is a syndrome, right? And there are in many instances other things that can lead to it. So the diagnosis in some cases might take longer than you expect.
All right. Thank you. Aaron, Ben?
Shibikian. I'm so happy to be on a panel with well-learned nurses, brothers, and sisters, and sister. It's wonderful to hear them answer the questions nice. It's so comforting. Though if I must speak to Anonymous, they addressed our questions extremely well. And I just want to endorse what Sister Tonette Johnson um, posted in the chat. You know, Anonymous, sometimes the best people to understand us is the persons
Yeah.
who can relate to us and who know exactly or nearly exactly what we're going through. And so this sisterhood um, group, the support group, might be the best thing for you. They can provide you with answers to many of your questions. They can direct you on paths that you should take that would have worked for them. I tell you, there's many options that a
Yes,
support group
definitely.
can offer to you. And definitely, I encourage you to join this sisterhood support group. I've seen it on Facebook. It's pretty new, but I am sure great things will be in store for you.
Great reiteration. All right. Samuel, I don't know if you have anything else to add.
Yes, I was listening to her, and not only can I hear the frustration, right? But with this syndrome, you would realize that a part of what usually happens is that there can be a lot of depression, right? Because you want answers and there's none available. And so I'm joining with Doctor in saying that the support group, because as Brother Christian would have said before, there are still a lot of studies that are going on because there are still, even though it's more prevalent now, there are still a lot of unanswered questions. And so, with the studies that are going on, I'm certain that we are going to know more tomorrow than we do today, right? And so, in the interim, your support group is what will become very important, because they might know of a doctor that you did not went to, right? And they that would have been able to help them in some aspect. And so with the pooled resources of knowledge and experience, you can be able to get things more under control than if you just remain isolated. And so I would endorse you joining that support group, and don't feel disheartened, even though I can understand that it's hard for you. Don't be disheartened. Understand that God will never give us more than we can bear. And so while it seems heavy now, while it seems as if everything is against you, just understand that there's going to be a way out that God will provide for you. So don't lose hope. Join the support group and move forward daily. Take it one day at a time.
I'll vote you for PRO for any organization. All right, good. Anonymous, you had something to add. Go right ahead now. Anonymous, you there? All right, I just want to say welcome to John Eugene. It's good to have you on the program here today again. And so I just want us to look at um, the question of, all right, let me go back here. All right, so this is a question that was posed by somebody last night to me too. And in terms of, they wanted to know if PCOS, if it can lead to other more serious complications like cancer. I think that was one in particular she would have mentioned to me. Does POS put women at risk for other serious conditions or diseases?
So Shibiki,
Before we move further, oh, doctor. All right.
no, go ahead, go ahead.
Yeah, I just wanted to touch a little on the psychological aspect.
Okay.
Um, Brother Ben had said anxiety. These women will experience anxiety and depression. Also, some women experience pseudo pregnancies, right? That's another deep psychological effect
Can you
on,
explain the pseudo pregnancy?
well, the woman will have all the symptoms or some symptoms of pregnancy. The abdomen might even begin to grow, but there would be nothing shown or seen on an ultrasound. Right, that's how we would say it's like a pseudo pregnancy because she would experience symptoms, but there would be no fetus or fetuses on ultrasound or no heartbeat.
Thank you for that that addition there. Yeah, I heard the term before. In fact, I don't know that I never heard the term, but I as soon as you mentioned pseudo pregnancy, I'm like, I wonder if it's it that we're having all this the symptoms and women are so anxious that hey, I think I'm pregnant now. And you know they will tell their husbands they go into hospital, do the checkup, and all of a sudden they hear, I'm sorry, you're not pregnant. Yeah, and that is one of the most depressive state a woman can be from that high adrenaline, and then it just crashes when your doctor says to you, no, I'm sorry, you're not pregnant. Yeah. All right, thanks for that, doc.
Yes, Shibiki. You said that, and I remember your earlier statement with how glad you are that you get regular periods. And I was supposed to say you're a member of the period posse. So that's a good thing. Um, I
Yeah.
also, before I forget, I must say Happy Teachers Day to all the teachers out there. Shibiki, once you're a teacher, you're always a teacher. It's the same with a doctor or nurse. Once you're a doctor or a
Valid point.
nurse, you're always a doctor or a nurse. So Happy Teachers Day to you and all those other teachers out there.
Yeah.
Teachers are responsible for us becoming doctors and nurses. And to the three tutors here, right? Aaron Christian, Elder Ben, and Sister Samuels. Happy Teachers Day to you as well. It seems I'm the only one that is not a teacher on the panel. In terms of complications, though, or more serious things that PCOS can cause, I did allude to the fact that it can lead to cancer, and that is secondary to endometrial hyperplasia, or the endometrium of the uterus or the womb becoming thickening. So it's normal for this to become thickened every month, and then a woman would shed that as she gets her period, and that is what actually comes out. But what happens is because this is triggered and triggered and triggered every month, and you don't have your menstruation, you can have some changes in the cell, and these mutations in the cell line can cause endometrial cancer. Um, it's not very, very common, but it is definitely something that you must keep at the back of your mind and look out for. In terms of other complications, we've been talking a whole lot this afternoon about infertility. That's another one, but that is one of that one is treatable. We also have the metabolic syndrome. You look for these patients; they can not only experience highs in blood pressure, but highs in blood sugar because they're insulin resistant, and your body is not able to digest or take care of the sugars that you intake. You can end up with high blood sugars and high cholesterol and all of these things. All of these which are exacerbated by obesity, of course. These patients also, and it is very important to mention mental health. Elder Ben and Sister Samuels mentioned mental health, and I am a huge advocate for mental health. We must always, at all times, ensure that our mental health is in check. These patients go through a whole lot. Sometimes it can be attributed to the growing of a beard or a moustache on a woman. It can be attributed to the fact that she's actively trying to get pregnant and is not getting pregnant. These things can all play games on your mind. Also, because we have so much hormonal disruptions, this also can physiologically cause depression, right? So it is definitely depression, anxiety, all these things we must look out for, and we must support the women because support is one of the biggest things or one of the biggest treatment in challenging mental health. So that is definitely one of the most important complications that we must look out for, a change or a decrease or a decrement in our mental health.
Thank you. All right. So do we have any other addition on that particular question?
Also, cancer, because I remember hearing you ask if it can cause persons to have cancer, right? Yes, they can have endometrial cancer, and that's because of the exposure to continuous high levels of estrogen, right? And so endometrial cancer is really cancer of the uterine lining, right? And because it is exposed to all of that high level of estrogen, you can end up with cancer, right? Gestational diabetes, high blood pressure also will come in there. Sleep apnea, you're sleeping and periods of time when you stop breathing and then you start back, and so that's some of the things that could happen. The metabolic syndrome, which is a cluster of signs and symptoms that indicate a significant risk of cardiovascular disease. It means that you can have that also, right? So all of these are complications of PCOS. And so hence it becomes important that when you see these signs and symptoms, get yourself checked, get yourself tested. Don't sit down and take up the standpoint, okay, in a couple of days, this is going to resolve itself. It is important because this condition can also have complications that are very detrimental.
Definitely. Thank you.
I think it's so important for that Mr. Ben, I think, mentioned the issue of gestational diabetes, because you might find that this individual with PCOS, now after all these years of trying, and then they finally become pregnant, then they're at risk for they're considered now high risk because of some of the issues that can now arise during pregnancy. And I think doctor talked about hypertension, right? So they can end up with high blood pressure during pregnancy, gestational diabetes, which is not only detrimental to the woman, but can also have some negative effects on the fetus. So I think doctor would have mentioned miscarriages and all of that. All right. So it's very serious. And Mr. Ben also talked about sleep apnea. All right. So persons do experience this after some period of time. And just think about the effects that that in itself can have on the individual as it relates to their sleep cycles, right? Or their periods of rest. If when I go to bed, I have these periods where I suddenly stop breathing, then you find that persons, they're usually afraid to go to sleep, right? So that can also have some impacts there. And everyone was talking about the psychological effects and so on of that. And we know it's very important that we're getting adequate rest if we're talking about mental health and all of these things.
Thank you very much for sharing. All right, so Anonymous had something to add. So you can go ahead at this point in time.
Yes. So, um, another thing that I've noticed is that, like you guys just explained about sleep, I do have issues with sleeping most of the time. Like I would go to bed and yes, I would drop asleep like maybe about half of an hour after. And so let's say I go to bed like after 11, I sleep like around 11:30 or 12. If I got up to use the bathroom at 1 or 2, that's it for me. I would not sleep back. That's one of my issues. Um, Another thing is I do not have the appetite to eat on a regular basis, especially when I'm on my period. I would be feeling so hungry, but like when I do eat, I feel as if I'm gonna throw up or I have some sort of sick feelings. And these are some of the things that affects me because like I said earlier, I've been going to several doctors and all they do is tests, which I understand that they need to do these tests in order for them to know exactly what is going on. But then I explained these problems and all they could say is that it's due to the sickness that you have, which is PCOS. And now that I found out that I have hypothyroidism. So what I want to know exactly is, um, like I mentioned, from since last year of September to this year, I've seen that my cycle it's been regular in terms when I say regular in terms of having it every month. I have not skipped any month or months, and the issue is when I do have my period, like a few days before my period, I would kind of like have this itching, and then my period would come like maybe 2 days after or a day after. Um, and so, like I said earlier, my period would last like anything from 12 days to maybe 14 days, 16 days. And then after my period, like sometimes what I find would happen is like a day or two, there is nothing. So I think to myself that you know what, my period is finished. But then, like on the third day after, I would, for some reason, pass a little bit of um, blood or of something. It's either maybe a piece of cloth or a little bit of discharge, which is most of the time being brown. So my doctor explained to me, and she said that at times, this is sometimes normal for a woman to pass these things before or after period. But then, why is it I'm having my period one, two, 3 days in a row? Then on the fourth day, there is nothing. On the fifth day, there is nothing, and then on the sixth day, there it comes again. And another thing is, I find that I really, most of the time now, as soon as my period is finished, like maybe a day or two after, I would have this itching, no burning or anything of the sort, but this itching. Um, I did do what you call it? Oh my God, I did do a pap smear, if I'm correct, if that's what you call it. And they said that everything was normal. Some of the tests that I did, most of them came back normal, whereas most of them, one showing that my blood count is low, which is something I've been struggling with as well, low blood count. Um, and a few, there is like a little bit of hiccups, but nothing much to worry about. My major concern is though, if these tests, like let's say I do 10 tests and out of the 10, 5 is normal and 5 is a little bit not so much to worry about. From day one that I got this problem to now, I see a little bit of better results. But what I'm worrying about is that what if, there is something something more serious or something that I'm missing out on. Because sometimes when I go to the doctor, um, someone might say A, and then if you go back like you go this month, they would say A, and when you go next month, it's B. So I do not understand. And then um, where I live here, these doctors, I'm not saying that, they are not qualified or anything like that, but they all seems to be doing the same thing over and over and over. And so it's like I cannot get a clear answer as to um, what exactly is going on. And, you know, it's very hard for me to find a doctor that could actually help me, because the first thing they do when you go and you do these tests and you do everything that they ask you to do, is the first thing is they put you on medication, like I said earlier, and this medication does not help. I mean, for me, I'm at a point where it doesn't help me anymore, because when I take these medications, I get some sort of side effect or I get really sick from them. So at the moment, with my thyroid issue, because of the fact that I have these side effects from taking medications, I do not take anything to treat the thyroid. And I was told back when I went back to Guyana that it could be treated, it's just that I need to take my medication. It's not as bad as how some people would have gotten it. So it's a bit complicated for me, because I want to know, like, if there is um like a specific something that I could do, or a specific person that I could go to get, a proper answer, because I'm willing to do anything. I mean, the part of getting pregnant, it affects me so much, because, I would look at my friends and people getting pregnant and having babies, and that would make me so depressed. I would be so depressed. I struggle with anxiety, um, depression. And so I'm desperate for help. I'm gonna say it. I'm desperate for help. I need help. So if there is anybody out there who knows of a person or persons that I could talk to, and that I could, reach out to them, or if they could reach out to me and, help me in some sort of way, because it's almost my entire life that I've been struggling with this, and I need some relief. It's not an easy task living with PCOS and having to deal with all these issues. There is times where, I would just sit by myself and I would say, Father, just take me. It's like I give up, because every month you have to deal with the pain, deal with the sickness, deal with the issues, and it affects my daily life. It affects so much in my life. And it's like I'm at a point where, I'm this close to drowning. So I'm asking if there is anybody, any doctor, anybody know of, or, a person or persons that could reach out to me, or I could reach out to them to just to guide me and tell me what to do, because it's like I cannot keep going in this roller coaster. Like, just every time you go visit a doctor, it's just about the test and the medication. No, I can't deal with it anymore. So if there's anybody, anything, please, I'm asking, please help me.
All right, good. So Anonymous, so what we're gonna do after this program, what I would advise you to do right away, to go to this support group. And yeah, Tonette, the young lady who would have shared the information. She's also part of the group. I know I was invited a long time to join the group, but I never really did a detailed check on it. But um, please feel free immediately after this program to join the group. If possible, with Tonette's permission, I can you give her, well, exchange contacts, and so at least she can be able to direct you accordingly, and maybe introduce you to the personnel who are part of that team, because the only reason why ladies come together is that people are facing with the issue, right? And they most likely there will be persons within that group that either they're overcomers or they're working on overcoming that particular diseases. So disease or well, syndrome. Let me say the correct medical terminology. The syndrome. So we have the persons on the panel. They don't have all the answers, as they would have mentioned before. It's a work in progress. So, a lot of research is still being done on it. But at least what I'm happy about with your shared story is the fact that there might be other persons out there who have viewed the program and they may know about other females who have been going through the same symptoms and all of those things that you would have shared with us, so they can be able to say, hey, that is what you've been suffering from. I would have heard somebody would have shared their personal testimony and they can also do a referral. So I'm so happy with your shared story because of that. The question I want to ask the persons on the panel, though, as it relates to what she would have shared, I want to know if by chance, I know she would have been experiencing a whole lot of pain, but if there is somebody who they have irregular periods, but yet still, when it comes, they pass a lot of clot years. It takes, well, couple days, well, for the period, and they pass another clot, but they have absolutely no pain, right? Is that PCOS? It comes without pain also?
So, Shibiki, pain is subjective. It is something that is different from person to person. Your pain threshold might not be my pain threshold. So somebody might be having severe pains, but to them it don't feel so bad. But if I get the same pain, I will be bawling.
Mm-hmm.
So it's subjective. It depends on persons. We can never know. It depends on how well you can bear it or how well you cannot.
So what about them feeling nothing? Like, I mean, normally as we're on the point of period, I don't really have pains, right? It's only because I know, oh yes, I am on my menstruation, but in terms of excessive, in fact, I can't even say excessive, in terms of pain, no pain really, right? So this is not like, okay, your belly hurting you slightly, but if somebody's saying they have no pain, but yesterday passing clot burst and everything. So that's what I want to know, if by chance, because I know Anonymous would have mentioned the extreme pains that she's been facing, but that's what I wanted to know in, the comparative analysis in this situation.
Definitely, you can have patients who are pain free and haven't been experiencing pelvic pains, though. Not all the patients will come in complaining of pelvic pains.
Okay. All right. Thank you for that. And Hollis, I'm so happy to have Nurse Hollis on the program today. Well, in the chat section. And she would have said, there are women who use natural remedies, bush medicine, and got through with it, but not much people believe in bush medicine. I wish to know which bush medicine is a vague term. Look how many bushes Guyana has. Come on. I mean, do we have a specific bush if you can recommend? And I want to say something on bush medicine. I love natural remedy, but we have to be very careful, right? Um, yeah, but we have to be very careful with some people. As soon as they hear a bush medicine is good, they use a whole set of it's like you're drinking tea, 2, 3, 4, 5 cups, and you're thinking, no, no, no. Sometimes you will kill yourself more than anything else. But Alice, I'll be very happy, or if anybody on the panel, if you know about any specific bush that anybody can use in good proportion, I'll be very happy for the recommendation.
Shabiki, I think Hollis needs to direct you to the herbalist. And I'm so happy that you mentioned about toxicities, unknown toxicities of bush, We spoke about that in a program prior. So I'm happy to see you employing that knowledge here.
All right, great. All right. So we just have 2 more questions before we wrap up today's program. So I know we would have, Anonymous, she was asking in terms of preventative measures, but I just want us to just clear the air on this particular question here, because I don't want people to go and say, hey, I didn't hear they talk about anything to prevent it. So if by chance, whether they are or they're not, I just want us to reiterate on it before we leave this program today. So what are some preventative measures, I should say, if any, for dealing with this issue?
I was gonna give.
So,
Right, go ahead.
oh, good. So, if you remember earlier when we started, we said that the cause is generally unknown, but there are some things that puts individuals at risk. For example, a family history of it. So mother, you have grandmother, other siblings um, that would have suffered or that is suffering from the issue, then that definitely puts you at risk. So genetics as well, and doctor would have been talking about this over and over again about obesity and the impacts that that can have on this condition, right? So it is very important that
Yeah.
we're watching our weight. All right. So the sister was talking about some of the things that you can do, and then Hollis mentioned, you know, Bush and so on. But we know that our food definitely can be a medicine to us. All right. So it's important that we're watching what we eat. Now, what are some things that we definitely would want to stay clear of when we look at the impacts of this thing and what it's doing to the body? We definitely have to reduce on the amounts of simple sugars that we're using. All right, so we want to use more carbohydrate, grains, things like oatmeal, brown rice, right? These are all things that we know is going to help with, doctor was talking about the spike in blood glucose levels and so on that these persons can experience. It's definitely going to help with that. Um,
Mm.
Low fat diet, right? So we want to ensure that we're also instead of frying foods, we can think about boiling, think about baking, steaming, right? These are all ways in which we can actually help to sort of maintain that that uh, or reduce our weight in some ways, because that's one of the main things that we want to do. Studies have shown that persons who would have lost weight as little as 5% of their of the weight, there were significant improvements in um, things such as the regularizing of the periods and some of those same clinical manifestations that the sister would have mentioned, right? So diet, exercise, very important, because we want to maintain a healthy body weight. So at least 30 minutes of exercise per day. I know for some of us, because especially in Guyana, uh, we don't exercise is not a part of who we are, right? So we don't take that time to exercise, right? But it's important that we start doing it. I know that persons are more sensitized to the importance and benefits of it. So from time to time, you do see some persons doing that. So I'm happy about that. But it's very important that we're doing it. Now, let's say, for example, persons who are overweight. You don't want these individuals to, because we're encouraging them to exercise, and you just don't get up one morning and say, oh, I'm going to do a 30 minutes of exercise today, because that can eventually pose some problems. So you start small, right? Do as much as you tolerate, but the goal here we're saying is for you to reach that period where you're saying 30 minutes at least, if it's three times per week. Um, that the sister also talked about the use of certain medications. Well, I'm not aware as to what those medications are, but there isn't necessarily a cure for PCOS. So what is I mean, doctors generally would treat some of those clinical manifestations that you're experiencing, and most definitely, you have to make those lifestyle changes. That is very important, because we know that those things definitely are risk factors. All right. So we want to sort of eliminate that risk. All right. So definitely exercise, diet.
Great. Thank you so much, Aaron Lester. Um, I must say good afternoon to Dr. Charles Shepard. I am happy to have you viewing the program here this afternoon. All right, great. So somebody's asking the question, our age is 29, what's the perfect weight for her? I don't know if any one of you know that answer offhand.
Yeah, Shabiki, she'll need to check her height and then do it on the
Right,
BMI
okay.
chart. You can Google the BMI chart and you'll see proportion for
All
weight
right,
and
great.
age and
Thank you
height
very
there.
much. All right.
Just to answer the question on preventative measures, so in every treatment, there's pharmacologic treatment, which is tablets given by the doctor. And then there's non-pharmacologic treatment. This disorder, this syndrome is heavily treated by non-pharmacologic treatments. You know, and when persons go to the doctor's office or they visit the clinic, they don't like hearing that I'm not going to issue you a pill on the first visit. Instead, I'm going to tell you to go home and exercise and lose weight and eat a proper diet. They feel as if the doctor might not have treated them because that is not what they were expecting.
Yeah.
I want to say though that this syndrome is heavily treated by non-pharmacologic methods. Many of those cases that come to the clinic, the OBGYN clinic, they are advised time and time again to exercise and lose weight. But you know, Shabiki, my favorite treatment option, and you know this because we did it before, is the New Start plan.
Yeah.
And so I'm going to briefly share with them the New Start plan again.
Go ahead.
N is for nutrition. And like Aaron Lester was saying, you want to ensure you eat the right things in the right proportions. So we do not want a high carbohydrate diet in this person because we know that carbs is equal to sugars. And because this person is insulin resistant, we don't want to load this person with a whole lot of sugars. However, when you're taking your carbs, you want to take your complex carbohydrates. And these are the ones that are going to raise your sugar slower, right? So you need to pay keen attention, take those complex carbohydrates, low carbs diet, and low fat diet. You don't want a whole lot of fat because obesity increases insulin resistance as well.
High fiber.
Go ahead.
No, I was just adding to what you're saying. High fiber, those carbohydrates that are high in fiber, your
Correct.
whole wheat and so on.
Correct. That's correct. The other thing is exercise. So remember, you exercise to stay fit. You remember, Shabiki, you exercise to stay fit.
Amen.
Exercise is recommended that, as Nurse Lester said, you do 30 minutes per day. Of course, it's very important to reiterate what he said. You can't start off like an engine, right? You need to go slow, take baby steps, and then accelerate to a pace that is comfortable for you and plateau at that stage for a while and then accelerate again, right? So you exercise or 30 minutes for 5 days is good, but if you can do 30 minutes for 7 days, it's even better. You want to ensure you take, so the other thing is water. We are at W now, water. Remember that you drink as much water when you're thirsty. You don't want to, it's okay to say we drink at least 7 to 8 glasses per day, but it's even better to say you rehydrate with as much as you would have lost because 7 to 8 glasses is not going to be okay for a construction worker who's working out in the sun all day. He is going to need more than that. So you estimate your losses and you take as much as you see needed. We're at S now, and S stands for sunshine. You need to go outside and get some sunshine. That's going to increase your vitamin D, right? We get vitamin D from the sun. ST. T is for temperance. You are advised to be temperate in all things. We want to put aside the alcohol and we want to put aside the smoking, because these are going to increase your risk of developing the complication of cancers. So we want to put all those aside, alcohol and nicotine, cigarettes. STA we are at now, and this is for air. If you remember, we want to take clean air into our lungs. So the best time to experience clean air, and even better now that we have a curfew in place, when much vehicles should not be on the roadways, the best time will be in the mornings to go outside, inhale and exhale about a couple of times, 2 to 3, just to cleanse your lungs and ensure that you expand them, you deflate them, and you exercise them. R is for rest. And this is very important. We love to hear this one. We love to hear that we must have enough rest. But remember that over-resting is being intemperate, right? True. So we need to strike a balance. If you're accustomed to working in front of a computer all day, especially now in the COVID times, you want to ensure that you step aside and give your eyes rest. That's very important. You step aside and you give your eyes rest from screen time. Also, you don't want to be up late hours, 12, 1, 2, 3, making worksheets for your students the next day, right? You want to ensure that you get at least 8 hours of rest. And Ellen White encourages us, and I said it the last time, when we sleep before 12 o'clock, your brain records it. Every hour you sleep before 12 o'clock, your brain records it as being 2 hours of sleep, right? So it's proposed that we get more rest when we sleep before 12 o'clock than if we go to bed after 12.
Yeah.
And the final T is for trust in God. And we know that God has reminded us time and time again that above all, he wishes that we prosper and be in good health. So we have got to trust him and hold him to that promise. There's nothing we can do without God. So that's definitely my preventative measure for any disorder, and even this one is even more important.
Yeah, thank you very much. And while you were speaking, I remembered, when Jesus healed the woman with the issue of blood, who have been suffering from it for 12 years, and there is no situation that he cannot handle for anybody who is going through, right? And that's one of the greatest positions that we can ever go to. So thank you for sharing that, Doc. Between Sister Samuels and Nurse Ben, I don't know if you have anything else to add to what these gentlemen would have shared already. So just let me know if you have anything to add. If not, we just move to our final question for this afternoon.
Yes, I just want to add something else, right? Because remember, Doc would have said, and quite rightly, that most of the treatment for this syndrome are basically what we refer to as home remedies, things that you can do right at home. And under our dietary changes, you mentioned about the high fiber diets that we can adjust to or incorporate into our diet. But one thing, and this one might hurt some persons, right? We need to limit less healthy, simple carbohydrates such as the soda. I know we love them, right? Soda, excess. He was talking about temperance in the New Start, right? Excess fruit juice. So even though fruit juice is very good for us, excess, we're looking at excess, right? So soda, excess fruit juice, cake, candy, ice cream, pies, cookies, and
Chocolate.
donuts. Those are the things that we need to stay away from. If you are going to get above this syndrome, then it is imperative that we need to make the sacrifice and make those dietary changes that we need to make, right? To go, of course, with the exercise and watching your weight and all of that. But many times people don't like to hear get away from those things, those niceties that we like, right? But when it comes to your health, right? And as Doc would have said, and you would have referred to it, the Bible tells us, wish above all things that you be in good health and you prosper, even as your soul prosper, as your soul prosper.
Thank you very much.
Yes, I think another thing that is very important for us to talk about is the issue of education. And this is so nice that we're having this program this afternoon, because
Mhm.
if persons are aware of certain issues, then they're able to seek early sort of medical attention, right? So they can have the requisite the requisite um, information at their disposal as it relates to treatment and how to properly cope or deal with some of the issues they're struggling with. So, especially for those persons, if you know you have persons in the family with the problem, then the likelihood exists, especially if you are partaking in this sort of lifestyle where you're eating anyhow, you're not exercising, then you want to, because those are high risk factors, then you definitely want to early sort of seek uh, some form of screening, right? So that you can identify the problem early before it escalates, or those symptoms are exacerbate, and then you end up with many of the complications that we mentioned.
Thank you so much. Sister Samuels, I don't know, after these guys that have spoken, if you have anything else to add. Go right
Yes, from
ahead.
a woman's standpoint, I would advise I would advise the women to be
Yeah.
in tune with your body. Okay? Track your period and no ovulatory symptoms.
I'm listening and I'm like, I remember when the girls we were talking about the ovulation period, and I'm like, okay, when is that again? And and I'm like, because just like many other females, it's like we don't really check our bodies, and we don't really. It's like for us. Well, I have a calendar that I follow use for
So
my
true.
period to follow that, right? Just saying, sure. When my period came last, I'm like, my period's supposed to come now. No, man. And when I check the calendar, I'm like, calendar, you are so perfectly on time, right? So, to the ladies, I like just have to reiterate that last point today. We need to check
Mhm.
up on ourselves. Nobody, our husbands wouldn't do it for us. The boyfriends wouldn't do it for us. Nobody else can do it for us than ourselves, right? Any other point to
So
add there?
true. Mhm. No, that would be all for me. Thank you very
All right,
much.
great. So I'm
Yeah,
gonna
and
just
just one more thing, since sister talked about the importance of knowing yourself. I think self empowerment is very, very important when it comes to dealing with these issues, right? A lot of times
Mhm.
um, we depend too heavily on other persons. Yes, it is important that we're getting the support and so on from other persons, but we have to empower ourselves as well, which I think is important.
yeah. Thank you very much for that
So
addition.
true.
So we're gonna just go on a 1 minute. I just want to put this ad up, and then the final question. I'm just gonna put the question up. Then I'm gonna do the ad, and then we're gonna close off with that particular question. Um, And the question is, what can we say to men? And I'm happy our males are on the panel this afternoon. What can we say to men whose wives may be encountering polycystic ovary syndrome? Right? What can we say to men whose wives may be encountering polycystic ovary syndrome? So while the men ponder on that, and of course, Sister Samuels, you can add your bit on it from a woman's point of view, helping them to understand, a little and to be a little more sympathetic on it. So just pay attention to this promo.
Today we present 21st Century Health and Lifestyle magazine. This initiative was a bold step launched in June of 2020. From the moment we would have started, we have been improving month by month. For this is a monthly subscription magazine. In this magazine, the focus is on the 6 dimensions of lifestyle, being mental, physical, spiritual, emotional, intellectual, and all of these topics would have been written by professional writers who have been trained in the topic they speak of. Along with these articles are puzzles in different forms for children. The theme of the magazine is to promote critical thinking as well as a lifestyle that will lead us all to Christ. One step further, we make it possible for small businesses or all businesses to advertise in our magazine. To know more, find us and follow us on Instagram. You can also add us on Facebook and send us a message. Don't be left behind. Don't miss this opportunity to be a part of something special, innovative, and intellectual. To know more about us, contact us on the information displayed.
All right. I am not certain if you heard it well, but for those of our viewers, there's some young people who came together, headed by Vernon Bennons, and they are doing a 21st Century Lifestyle magazine. It's just 300 Guyana dollars for the soft copy and $400 for the hard copy. It's a monthly subscription. So I'll be very happy if you can make support. They have a Facebook page called 21st Century Lifestyle. I realized that the background music was it was higher than the voice itself, but you can check them out. You can make contact with me. Let's support our young people as they venture out into different fields and areas of expertise. But I must say the magazine, I had a preview to 2 of them. I wrote an article in one of them so far, whereby you have persons who would have written articles and you can read and be edified. So just support our young people. So back to our final question as we wrap up for today. What can we say to men whose wives may be encountering polycystic ovarian syndrome?
I think something that is very, very important for persons in general to understand, but in this case more so the men of those the husbands of those women who are suffering from PCOS, is that it is a very tricky issue, right, as it relates to things like fertility and some of those clinical manifestations that you might see in persons. For example, the sister earlier was talking about the depression and anxiety that she has. So you can see significant changes in moods, right? So one of the important things to do is to educate yourselves, right? Be okay with these clinical manifestations. So when they appear, you're able to support your wife throughout those periods and not in any way do anything that is going to further drive her into more depression. Right, so it is important that you're educating yourselves on the issue, and this is a problem that we have time and time again with men. in society as it relates to issues affecting women. When you go to these clinics, if you're going to see a gynecologist, clinics as it relates to OBGYN issues, basically, you hardly see men accompanying their wives and so on to these areas, right? And that definitely needs to change, right? So we need to educate ourselves on these issues that are affecting women, so that we can better support them, especially as it relates to this issue. All right, so we have to understand that sometimes the women, they just can't help what they're expressing, right? You might want to know, oh, you're getting so fat, but then sometimes the woman just cannot help it, right? So we have to, and that's why it's important that we have to get education, because it's very well, in many instances, as it with PCOS, no fault really of the women that they might be experiencing some of these things. So we definitely need to also show appreciation, right? Because they're dealing with so much already, right? So we definitely need to ensure that we're showing that appreciation, to them as well.
Thank you very much. Nurse Ben?
Yes. Yes. In today's society that we live in, everybody is blaming everybody. And so what I would want to say to the men, that this is not one of those times that you want to play the blame game. It's not about that. You would need to educate yourself so that you will be able to support your wife. It's not about who is responsible and always trying to score a point. Okay, I can have children if she's the problem. It's not about that, because she is going through something that you will not go through, because it's different. And so you need to understand that you have to educate yourself. Go online, find somebody that knows about it, some nurse friend, a doctor. Educate yourself. When you educate yourself, support her. There are going to be days that she will be stressed out or depressed, as she might lash out at you, as we say here in Guyana, right? Her mood swings will be different. She's going to react to things that you don't expect her to react to. And that's where your knowledge comes into play. Knowing what is happening to her, then you will be able to support her and to be able to hold her hand and guide her through. Because sometimes you have to hold her. You have to hold her hands and take her through it, because there are days, as I said before, she is going to be really depressed. And so that's where you need to step in. It's not the time to be aloft and try to blame and she always and those things. You need to step up, be the man, and support. When she needs comforting, you need to comfort her. And always, especially if you're a Christian, pray with her and for her.
Beautiful.
Not just pray with her, but for her. And let God do what he seems best, because there's always an answer. There is always a solution. And the best person, as Shibiki would have said before, the best person that we can go to is God. And so even when the chips are down, even when you as a man, I'm not saying that you will not feel frustrated, but that's not the time when you need to take your frustrations out on the on your wife. This is the time when you want to support, when you want to hold her hand and guide her through this every step of the way.
Thank you so much. Sister Samuels?
I think the males have covered most, but the point I want to add is for the male to be interested. Just by being interested, all the other points will follow.
I like that. Doc?
I concur with what all of them have been saying thus far. I want to thank you, Shabiki, for having me on the program. It was a beautiful program on a beautiful afternoon in Guyana. I trust and hope that everything that was said has touched somebody or has made them more informed about the issue. To the males out there, the husbands, the prospective husbands, um, the boyfriends who are going to become husbands soon. I just want to say if your partner or significant other is suffering with or has PCOS, that you need to be an encourager. Be an encourager because the world has already got enough critics. She don't need another critic on her side. Um, to those, I want to say that you need to support your wife. Let her know that you're there to help her in her exercise regime. If your wife is going to exercise, it is going to be awesome to go along with her um, and encourage her. You want to ensure also that you show love and care and respect, and this is going to be in keeping with ensuring that your wife's mental health is optimum. You want to keep on encouraging her, showing her the kind words, no resistance or no resistance should be shown. And also, you want to be in the know, be interested and be informed, and ensure that you remind her gently in a caring way that she needs to persist. So if she might be slacking up on some days, you are her gentle reminder. And like Elder Ben said, in all things, prayer must be first and foremost. Remember that all healing comes directly from God, and He's the only one that can heal you, even if He's doing it through the doctors. So remember to encourage, keep her mental health in check. Whenever she exercises, you go with her. Whatever dietary changes she make, you eat the same food too. It's easier that way, and it's better that way. So we all should work and do our part in ensuring that we meet out to someone with PCOS, share our knowledge with them, and direct them on paths or avenues that can create a positive change for them. Before I take my leave, Shibiki, I also want to say that I'm wearing pink today because I stand with my breast cancer persons who are
Yes.
fighting. I stand in solidarity with them. And I also noted that our names are in pink this afternoon. I don't know if you did it or if it's by accident, but here on Issues in Focus, we are standing in solidarity with those who are suffering with breast cancer.
Yes, thank you so much. And one of these good days before the month has ended, we will have some more health talks. And we want to look at, well, cancer is so, oh my gosh, you can do an entire month's program just on cancer alone. But I know Doc is on one of my, well, in my small committee. So we will definitely be looking at maybe we'll do a talk on breast cancer, see if we can have some of those persons on. And but we want to look at a lot of people are dying from cancer these days. So stay tuned for those programs in the future. So I'm going to ask Samuel. Samuel, if you're hearing me, to close us in prayer this afternoon.
Yes, let us pray. Our Father and our God, we are thankful for your mercy and for your grace towards us. We are thankful that you are still the healing balm in Gilead. and that there's nothing that you cannot heal us from. And so we thank you in a special way for your divine guidance and for the way you would have led out in this discussion this afternoon. We thank you for using Sister Vifos and in a special way, and those that are in collaboration with her in this special way to bring things that are not just health and social but spiritual issues, so that those persons that are affected by these things can find healing, can find a shoulder to lean on. We thank you for those that would have listened. We pray in a special way for the individual that would have shared her story this afternoon. We pray that you will continue to be there by her side as you are always by our side. And we pray that you will be with the husband as well, as he is supporting her daily in her battle with this syndrome. And so we pray that you will watch over them, give them the courage, the strength to keep pressing on in spite of. And so we pray that you bless everyone. Help us to do that which is right and pleasing in your sight, because you would have encouraged us that we need to be healthy. And so help us to do what we need to do so that we can remain healthy, not just physically, but spiritually also, I pray. And thank you in Jesus' name. Amen and amen.
All right. So once again, I just want to say thank you to all the viewers. Thank you very much, Sister Samuels, Dr. Hedar, Aaron Samuel,
Welcome.
and Aaron Lester Christian. It was good having
Welcome.
the program. And do take care until we meet again. So long, folks.